Well, good evening and thanks for joining us tonight here on News 20 on GTN. We've got a great show for you tonight. Joining me to my right, April Zubak. You might as well host this show.
I'm a regular.
You're a regular here on the show. We've got something very important to talk about tonight. And to your right, we have Sandra Johnson, study volunteer for the American Cancer Society. Glad you could join us also.
Thank
we
you.
appreciate your time.
Glad to be here.
Let's start off with you, though, April, communication specialist for the American Cancer Society. Tell us a little bit about what you do if somebody hasn't seen you on the show before.
Well, I help spread the messages of the American Cancer Society. We want to make sure that everyone knows what increases your risk of cancer and what you can do to help decrease your risk, and the early screenings that you can do to make sure if you have cancer, you can fight it at the earliest stage possible.
We've talked about this so many times in terms of this affects so many people. A lot of people hear about it, they see it on television, they see shows like this, they see it in the newspaper, but until it actually touches their lives, they don't understand what a difference ACS can make in their life.
I think that's true, and I think so many people know the American Cancer Society. We're a trusted brand. We celebrate 100 years this year, but you're right that people don't know the scope of everything we're able to do for people until you need us. And when you do, you're going to be really happy that we're here, because I think we're a trusting source of information. We have really wonderful programs to help people get through their cancer journey as well. And we're here for you day or night.
And that's on both sides of the fence, whether you're the one who's been diagnosed with cancer or you're a family member. This can help you on both sides of the ball.
Yeah, and even as a staff member who's been there nearly 10 years, I've come to the American Cancer Society as a patient and as a caregiver. So I've been able to see that firsthand. And I think it's true. And going through cancer is very difficult. But in some ways, being a caregiver can be just as difficult or harder. It's very different, but it's really, really hard to see your loved ones go through that.
As we start the show off tonight, let's go ahead and give out contact numbers for the American Cancer Society so they can write it down. If they miss it, you can come back with a piece of paper a little bit later in the show. We'll give you all again.
Yeah, we're specifically really wanting people to help us with our Cancer Prevention Study 3, and the phone number for that is 888-604-5888. So we really hope people will reach out to us.
Now we're going to talk to you in a second, Sandra, about being a study volunteer. But for this part of the show, what we're talking about is this Prevention Study 3. What does that mean for the community?
It means a lot. The American Cancer Society is the only organization that does a study of this kind. And basically, we're looking to enroll 300,000 adults from across the country into this study. We're looking at the lifestyle, genetic, and environmental factors that cause or prevent cancer. So we're looking at really basic information, things that you do in your daily life, but we really need to make these connections, and we need people who have never been diagnosed with cancer. So this is unique. We're not looking for the cancer survivors. Survivors can definitely reach out to those they know, but if you've never been diagnosed with cancer, you can really change the face of what cancer means to us and future generations by helping us with this study.
And Sandra, what got you involved in this? What made you step up as a volunteer?
Well, the thing is with me, I am a 17-year breast cancer survivor, and I have been volunteering with the American Cancer Society now for like 15 years. And I really thought this study was really important to get out into the Black community. And so my group and we just really working hard to get that word out to our Black community.
What's it make you feel like to step up to the plate after you've gone through something like you've gone through and help out so many people?
It makes me feel very good. This is a very rewarding program, and I think the more that we can do to help a study like this, I think it'll make a better world for everybody. More birthdays.
When you look at a study like this, it's different than the ones before, where you're looking for people who have cancer. For people who don't, what can they expect? Because I know the first question out of most people is how much time is it going to take, and how invasive is this going to be into my lifestyle?
Well, it's real simple when you think about the enormous impact it can have. Basically, you would come to the American Cancer Society's website or phone number and schedule an appointment. And at that time, you would do a survey online, real simple, just answering questions about sleep habits, eating habits, stress levels, simple things. And then when you come to your actual appointment, you will have a waist measurement. We will draw a little bit of blood. It's just like when you give blood at the doctor's office. It's not a lot. And you'll do another quick survey. That's it. You're enrolled. And then after that, every 2 years, you'll get a survey in the mail, just snail mail. Fill it out, as your leisure, and then we're keeping up to date with everyone on that information. What happens with the blood, this is actually the third study of this kind in cancer prevention studies. This is the first time we're drawing blood. That blood will be stored away and frozen, but if someone's diagnosed with cancer and they'll report that on that survey, we can pull that so we can do additional research into that to find out, what more can we make as far as connections between your lifestyle, your genetics, and the cancer diagnosis that you had.
What's been the response so far? Not only here in St. Louis, but across the United States.
Overwhelming. We've been enrolling actually for a few years, but this year we are really hitting the ground hard because we have to have it done by the end of this year. So in years past, we've had a lot of our supporters enroll. And now this year, we're reaching out to the general public, people that we're not in touch with on a day-to-day basis, but who also care about cancer to step in. And the St. Louis community and nationwide, people have been very, very giving in enrolling the study. Fortunately, people can see the impact that we're going to be able to make. So we're over 230,000 people nationwide enrolled already. And we need to get to 300,000 by the end of this year.
Maybe we get the extra 70,000 from this show. How about that?
Right.
Sandra, on a serious note, kind of walk us back through what it was like for you when you first found out, and talk about the struggles you went through, how you overcame it, and how important the family and friends are in something like this.
Okay. First of all, when I first heard that I had breast cancer, it was very devastating. I always have had a good support group, my husband, my daughter, family and friends. It was just one of those things I knew that I had to beat this. And I had to beat this because I want to spread the word that it can be beaten. It's not a death sentence. It is just wonderful to be a part of spreading that word. The thing is, I have a group that's it's called Survivors Helping Survivors. We meet every third Saturday of the month at the Jamestown Buff Library, 4153 North Highway 67. The hour is from 10 a.m. to 12 p.m. That group is just a wonderful group. We have done a lot of things with the study so far. And the thing that really makes me push for it is because I have heard that we have such a lack of participation with our Black community. So the thing is that I want to get out there, walk those streets, beat the doors down, and let everybody know, hey, come on, let's get with it. We're a Black community. We need to know what's going on, so let's help each other.
So many times through the years, we've talked about how cancer touches mothers, fathers, sons, daughters, you name it. When you hear stories like this and seeing people overcome this, it just makes, I guess, your job and what the Cancer Society does as a whole, it really pulls it to the forefront.
Absolutely. Sandra talked about more birthdays, and that's what we're all about. And we are really proud that 400 people a day are celebrating birthdays who otherwise wouldn't have some time ago. The American Cancer Society has contributed to a 20% decline in cancer death rate since the early 1990s when we had its peak. So the American Cancer Society is making great progress, and we're very proud of that. 2 out of 3 people are surviving cancer today, but we're not done until it's 3 out of 3. So we love when people like Sandra step up and share their story and go out and tell people how they can fight back and to get their mammograms and everything that you can do to lead a healthy lifestyle to help reduce your risk, because we really are striving to get that 3 out of 3. And the other thing is, which I know you're familiar with and Sandra is as well, is our fundraising events like Relay for Life. And those dollars that come in are so important. They're what help fund things like Cancer Prevention Study 3. And we wouldn't be able to do this type of research and the research we have going on at WashU and St. Louis University, we wouldn't be able to do it without our donors. So it really takes everyone. And when people can step up and share their story, it really makes everything that we do meaningful to everyone who hears it.
When you look back, let's say 20 or 30 years, do you think that people have really stepped up to the plate now to participate, not only monetarily, but through research and events like this, because it's been brought to the media has brought this and yourself and to the forefront, where before there wasn't all these social media things. It just wasn't, it was almost like a hidden thing.
Absolutely. I think you can look back our entire century that the American Cancer Society has been around and the progress that we've made. That at the beginning, people wouldn't say the word cancer. People didn't talk about it. A treatment for someone who had cancer back then was distraction. A doctor would say, have some champagne, go on a carriage ride. There was nothing that they could do. So I think through the dollars that have come in and people sharing their stories and being more comfortable with it, yeah, we're absolutely making it easier to talk to. We're making it easier for someone to go into the doctor's office and not be afraid to say, hey doc, I'm coming up on 50, it's time to schedule my colonoscopy, right? And the patient has to be their own advocate. So absolutely, the more and more we can get out there, the more and more people are comfortable talking about it, the more that we can do, that we're all empowered to fight back against it.
It seems like there's two avenues that people go through when they find out they have cancer. Some kind of just keel over and say, I'm not going to fight it, and others like yourself go through it, they fight it, they win, and then become an advocate. How important is it to have that positive attitude, that hope?
Well, it's very important to have a positive attitude and the hope, because if you don't have a positive attitude, like you said, you're going to go ahead in a corner somewhere and you're just going to drop off and you're not going to try to fight it. But a positive attitude gives you a look towards the future. And that future is to know that I can beat this. I will be here for my grandkids, for my family, for their grandkids, and everybody. So, I mean, a positive attitude, you can beat anything if you have a positive attitude.
Did you ever think the day that maybe you heard the news of this, that 17 years later that you'd be sitting here as a research volunteer, leading a group, being a leader in the community?
Well, I didn't think I would be sitting here, but I did know that I was going to be leading a group. That's the first thing I thought about when I conquered cancer. I said, I'm going to go out and I'm going to start a volunteer group for cancer. And that's what I did.
What would you say to the people out there who says, well, this won't happen to me, this won't happen in my lifetime, or to any of my loved ones? What would you say to them?
I would say to them, don't think that way, because nothing is guaranteed to you. I always say that, to me, for the good Lord up above, he didn't promise that you was going to be exempt from anything.
We know with a lot of other things like diabetes and things, there's, you eat right, taking less sugar. As far as cancer, I know this is probably a 2-hour answer to this, but just on the layman scale, is there anything that people can do or can't do to maybe cut the risk of certain kinds of cancers?
Yes, and I think this is a good question for the topic of cancer prevention study, because our first study, which was actually called Ham and Horn, that was the first study that we did of the population that made the connection that smoking causes lung cancer, and that led to the first Surgeon General's report and all the restrictions that we have seen more and more, because we know the dangers. The later studies have shown the dangers of secondhand smoke. They've also shown that obesity can increase the death rate in at least 10 different cancer sites. So we're finding more and more things like that. So basically, it is the same as a lot of the other ailments like diabetes and heart disease. You want to live an active lifestyle, be physically fit. You want to have a healthy diet, lots of fruits and vegetables, low on the high-fat foods. No smoking is really important. Also, alcohol use can be a risk factor. And the final thing that everyone is very empowered to do is to get your screenings when you need them, because there are so many deaths that could be averted if people got their screenings and found their cancer early. Because when you find your cancer early, your prognosis is better, your treatment options are more. There's more things you can do, and more things that are maybe easier than you would think. There are so many advances with oral chemotherapy, targeted therapy, so that it's specific to your specific cancer. We've come a long way with a lot of that, but you really have to take it upon yourself to make sure you're getting tests when you need it. And even, we have the guidelines, but sometimes you need them early if you have a family history. So talk to your family members and know what kind of cancers have been in your family so that you can be aware of them and communicate with your doctor.
As far as yourself, Sandra, is this something that was caught through a mammogram, and was it caught early?
It was caught early. It was caught through a mammogram. And I will say that April is right. Early detection is the key. You have to get it. If you get it early, you have a better chance of surviving.
There's so many people out there who think, well, what I don't know, it can't hurt me, but not in this case. Would you agree?
I would agree. I would agree, because, cancer is one of our bad diseases. It really is a bad disease. If we can conquer, I would like to say, if I could, I would like to go right back to our Black community, because with our Black community, we are at such a high risk of this cancer. And the researchers that does this study is very, very leery about cancer in the Black community, because they haven't had a very concrete evidence of what's going on with us. That's the reason why I'm in this study, because I'm trying to get more Blacks involved to come in and do this study, because we need it for everybody, not just for the Blacks, for everybody. But it would help us.
And you mentioned 300,000 people across the country involved in this study at the end when it kicks off. What is the long-term goal? I mean, is it followed for 5 years, 10 years, 20 years?
Yeah, you'll be followed for a couple decades, and the reason that we're enrolling a new generation is that Cancer Prevention Study 2 is actually still going on, but they're getting older, and we need a new, younger group. And what Sandra said is so important, and that's one of the focuses of this study, is the diversity of this group. It's a huge focus that we want to make sure that every different community is represented, because what Sandra said about the disparities is true in incidence rates in a couple different types of cancers, and also death rates. And we need people in this study so that we can figure out what that means and what's causing it, and what can we do differently in different types of people to continue to target the treatment, and maybe even target screening guidelines. We don't know what we're going to find from this, but there may be pockets that we have to tell them, to do something different. And we're not going to find these things if we don't have the groups in the study. So we are really trying to get out into the African American community, especially in St. Louis. We have an enrollment site coming up at St. Louis Rams Park, and we really hope that our community, no matter who you are, we need everyone in St. Louis, no matter what color your skin, no matter your age between 30 and 65, we need a good range. We need you in this study, so please make your appointment.
And if you're just joining us right now, we're talking with the American Cancer Society about prevention study number 3, and let's touch on that again and kind of walk through what we're looking at in terms of a commitment for somebody, because that's always the first thing people feel. Well, I'm going to be tracked, they're going to know everything about me for 20 years, and the information is going everywhere, but it's not. It's
not. The moment you sign up, you're given a barcode with a number, so that's how you're tracked. We've also had the question of, well, if you find something in my blood sample, will I be contacted? And no, because it is so anonymous. That's not the purpose, is to study you and your cancer. The purpose is the overall impact that we can make on cancer and on research. So the time commitment is simple. On July 13th, we're going to have enrollment at 3 locations: St. Louis Rams Park in Earth City. They've been a great partner. Mineral Area College down in St. Francis County, and the First Baptist Church of Arnold. So we're all over, depending on where you live. You'll make your appointment and do a small survey. When you get to the appointment, it's a survey, a measurement of your waist, and a small blood sample. It should take, I believe, roughly a half hour. It's not very long. And then after that, you can sit back, relax, and wait for your mail to come to your door. Every 2 years, you'll get a survey in the mail just to answer questions about your lifestyle and your habits.
When you look at a commitment, Sandra, I was going to say like this: it's very small, but it can impact so many people's lives down the line, whether it's in that 20-year span or 20 years after that, as your grandkids are coming up.
Right. It's so true, but it's one thing I would like to add to the study is that one thing April didn't mention, and I would like to do the study that we're doing is for the people that we're asking is for people that haven't had cancer, and that's from the age group of 30 to 65. So we want to just make sure that that these people know that it's for people that haven't had cancer, for the blood. And we're going to compare that blood, well, the researchers, not me, they're going to compare the blood with the genetics of the people that have had cancer. So that's why I thought it was just really super for this project to be done. Get back with your question that you asked me. I forgot the question.
Well, when you look at this as a whole,
Okay.
there's so many ways you can give back. Some people give financially. This is another
Yeah.
way to give to the Cancer
Yeah.
Society. And when you look at this long term, it's not just a 20-year span. This is going to help people who are your children and
Yes,
their children.
children.
So this could have an impact for the next 100+ years.
Yes. And I really appreciate the American Cancer Society for doing this, because when I think about my grandkids coming up over the years, I definitely don't want them to have to go through anything like this. It's just a terrible disease. And if we can stamp this out, this would be a wonderful world.
The one thing that we talk about a lot with cancer survivors and with you, April, here on the show is how someone wants to be treated once they're diagnosed. Were you, I want to talk about this, I want to be open, or were you kind of just let me deal with this myself, I'll talk to you when I want to talk to you about it?
Well, you have 2 types. You have the ones that want to talk and the ones that don't want to talk. I was one of the ones that couldn't stop talking. And I just talked. And my thing is that the ones, when you get with a group, a support group that really can help you, the ones that don't want to talk, they will start talking.
Did it make you feel more at peace, more comfortable to know that you had other people to talk to?
It did.
And that you weren't dealing with this just yourself?
It did. It really did. To make things a lot easier for me to have to talk to somebody, to have somebody to talk to, it made it a lot easier for me. I was just overwhelmed because I didn't think a lot of people would understand about the cancer. Some people look at you in a different kind of way when you do have cancer. Some people look at you with sympathy. Some people look at you as if you got a disease that don't touch me, it's catching. But when I look around and I find all different people in the world, I'm just like, you know what? We're gonna all beat this together. So don't be afraid that I'm gonna give you something. Just help me fight this.
And did it make you look at life a little differently? In
Yes, it
terms
did.
of cherishing the little things that maybe everybody takes for granted every day?
It did. Made me think everybody was angels. It just made me feel really good. It made me look at life. It made me a better person.
Is this the general consensus that you hear? Because I know you deal firsthand, April, with a lot of survivors that once they get involved and they start spreading that message that this is the general aura.
I do believe that, and the people who get involved, they are very grateful for everybody around them, and they really want to put everyone else at ease, and they really just want to reach out, with their web of however many people they can touch and however many people they can impact, and it's really powerful. I have a personal story about CPS3 that I want to share too.
Okay.
Because I was speaking with someone in the community, a partner of ours, and they were not sure if they wanted to enroll. And there's probably a lot of people out there who are thinking, oh, this is fine and great, and they're going to make a real big impact, but somebody else is going to do it. A few years back, I was at a relay event, and I wanted to sign up, and the line was really long. So I said, I'll wait till the line goes down. I'll wait. And I kept looking, and I sure should have gotten that line. And when I went over there, they said, we're done, we're full, we can't take any more people, it's closed. So I thought, shoot, I'll get them next time. And I didn't have a next time, because then I was later diagnosed with melanoma. And I sure wish that my information was in this study and that my blood was in this study, because I already would have been pulled, and they already would have been looking at my history, my family history, my lifestyle, my sun exposure, anything to try to find a link for the cancer that I ended up being diagnosed with. And I missed that opportunity, and I can't take it back. And I can't now have that impact for my children. And so if you're watching this and you're not sure if you should, I hope you'll take my story, because you might be diagnosed next year or next month or in 5 years.
Yes.
And you're really going to hope that they can research the kind of cancer that you had.
And the one thing that I would want to stress is that you don't understand how important the Cancer Society is until you have somebody who goes through it. And you need that information, that ear to find out more. If somebody wants to find out more, let's give out the phone number and the website again, please.
Absolutely. Easy to go to our website at cancerstudymo.org. That's cancerstudymo.org. That'll list the enrollment sites that are coming up for our region. And a phone number that you could call is 888-604-5888.
As we start to bring things to a close here on the show, Sandra, once again, what would you say to everybody out there about getting involved, not only in this study, but stepping up to the plate and getting involved in the community? And there's so many things that they can help out with the Cancer Society.
I would say to everyone, please, please get involved with the American Cancer Society, because it will live long enough. It might affect you. So, everybody should just work together. I think it's one big disease that we can beat, we can overcome it, and everybody will have one more birthday. If I can just say one more thing, we are doing a big push this Saturday up at the Jamestown Buff Library at 4153 North, Highway 67. Last push for this cancer prevention study. Please come up to the library and ask us about this study and enroll, please. Thank you.
And as we wrap things up here, you deal with this every day. It's your job. What would you say to everybody out there?
I would say if you're going through cancer or know someone who's going through cancer, just speak up and let them know to contact the American Cancer Society. Even if you don't know what you need or what they need, just give us a call. We're there 24 hours a day, and we have a lot to offer ourselves, and we also have a lot of partners in the community that provide things as well, including just information. It's really powerful to be able to go into your doctor with specific questions and knowledge, because it's really scary and it's hard to understand. And as far as the study, like I said, just please get involved. It'll impact your life, your kids' lives, everyone that you love. So I hope you'll enroll today.
And one more time, the numbers.
The phone number is 888-604-5888, and the website is cancerstudymo.org.
Well, April, Sandra, thank you so much for your time. As always, we appreciate it. Thanks for being on the show. We hope you enjoyed the show tonight. Have a great evening. We'll see you tomorrow night right here on News 20 on GTN.